Yeah, I think with all of our devices, whether we're talking about surface modifications or we're talking about the device themselves, the two important issues are safety and efficacy and the interplay between those things. Surface modification has become increasingly important in flow diversion, and I think the reason for that is that flow diversion is incredibly effective, particularly for aneurysms that are otherwise untreatable, but because of the nature of the product and in particular the high amount of metal surface area, they are inherently more dangerous with respect to thromboembolic complications. That means they require us to use relative or quite powerful antiplatelet medications that then introduce a second layer of potential danger to the patient. And so if we're going to continue to use flow diversion, which I think we will and we have to, then we should be looking at ways of making all of those things safer. And I think that's what surface modification is doing, and I hope that it will continue to make advances in that direction. I mean, I think Heal is a really interesting coating because it is really two coatings in a sense. And so I think we're getting a lot as operators, and the patients are getting a lot from this one coating. I think if it really does reduce thrombogenicity, if we can really come down on our dependence on antiplatelet medicines, then I think we offer a safer product, which I think is super important, and we start to think about expanding into different indications, including in ruptured aneurysms or acute cases. And then I also think that there are other pathologies beyond aneurysms that have similar issues, such as atherosclerotic disease, whether it be intracranial or cervical. And they are particularly problematic for us because we encounter those in an acute setting where the patient has a super high hemorrhage risk and we need to get the vessel open. We're faced with no other choices. And so there, I'm very interested to see if Heal can make those cases, those really extreme cases such as tandem stroke occlusions, can that make that safer? It would be magical. It would never have any complications, aneurysms would all go away. I think, one of the things that I was a little bit troubled by from the discussions today was the notion that some of the models that we were testing things in weren't perfect. I don't understand that. We're never going to have perfect models. Models aren't designed to be perfect. They're designed to explore theories and allow us to develop and go down different pathways that we subsequently, when we're secure enough in our knowledge, we then do proper randomized controlled tests in patients, and that's the ultimate goal. That's the ultimate assurance. So, I'm probably relaxed. I don't know what the perfect coding looks like. I'm actually quite interested in the journey because I think it's hubris to think that we know what we need. I think as we go down this pathway, we'll identify things that we didn't realize, and I think that's what really excites me.